Welcome to eCareDiary.com's Caregiver Tips and Clips. I'm your host Meghna Giridhar. Each week we will focus on a caregiving issue in the form of a short educational video. June 7th is National Cancer Survivors Day, and in honor of this event, we will be providing an overview of common cancer types and treatments. Cancer is an abnormal growth of cells that can start anywhere in the human body. Typically, human cells grow and divide to form new cells. When cells grow old, new cells take their place. However, in cancer, old cells survive when they should die, and new cells form when they are not needed. These extra cells can divide without stopping and form tumors. As tumors grow, some cancer cells can break off and travel to other parts of the body to form new tumors. There are more than 100 types of cancer. According to the National Cancer Institute, the cancers highlighted on this slide are the most common. Of them, breast cancer is the most common, with more than 234,000 new cases expected in the US in 2015. The next most common cancers are prostate cancer and lung cancer. Because colon and rectal cancers are often referred to as colorectal cancers, these two cancer types are combined for the list. Let's understand some of these. Excluding skin cancer, breast cancer is the most frequently diagnosed cancer among women. Breast cancer ranks second as a cause of cancer death in women. Lung cancer accounts for about 28% of all cancer deaths. The 5-year survival rate for all stages of lung cancer combined is just 16%. Cigarette smoking is the most important risk factor for lung cancer. Prostate cancer is the most commonly diagnosed cancer among men, excluding skin cancer, and the second most common cause of death. PSA screenings and digital rectal exams can help for early detection. Skin cancer is divided into the non-melanoma and melanoma categories. Non-melanoma is the more common form and it's curable. Melanoma is the most serious type of skin cancer, attributed to over 75% of all skin cancer deaths. Colorectal cancer is the third most common cancer in both men and women. When it comes to kidney cancer, tobacco is a strong risk factor, as well as obesity and hypertension. Cancer diagnosis begins with a complete physical exam and a medical history. Blood, urine, and stool tests are common. When a tumor is suspected, imaging tests such as X-rays, computed tomography, magnetic resonance imaging, and endoscopy examinations help doctors determine the cancer's location and size. A biopsy is often performed in which a tissue sample is removed from the suspected tumor and studied to check for cancer cells for confirmed diagnosis. The earlier cancer is diagnosed and treated, the better the chance of it being cured. Some types of cancer such as skin, breast, prostate, and rectum may be detected by routine self-exam or other screening measures. Most cases of cancer are detected and diagnosed after a tumor is felt. The person with cancer may need more than one type of treatment, and each comes with its own challenges. Let's understand some of the treatment options. Surgery can be used to diagnose, treat, or even help prevent cancer in some cases. Most people with cancer will have some type of surgery. It often offers the greatest chance for cure, especially if cancer has not spread to other parts of the body. Chemotherapy is the use of medicines or drugs to treat cancer. Radiation therapy uses high-energy particles to destroy or damage cancer cells. It is one of the most common treatments for cancer, either by itself or with other forms of treatment. Stem cell transplant can include peripheral blood, bone marrow, and cord blood transplants. Photodynamic therapy is a treatment that uses special drugs called photosynthesizing agents along with light to kill cancer cells. The drugs only work after they've been activated by certain kinds of light. Transfusions of blood and blood products temporarily replace parts of the blood when the person's body can't make its own. Cancer affects not only the person diagnosed, but all those who care about the person. It is crucial to find the appropriate support system, gather information, and plan with your care team to ensure effective treatment and a possible chance at resuming a normal life soon. Thank you for joining us today. To access more caregiver tips and clips, Visit us at www.ecarediary.com. Until next time,